Okay, so we're back. We're going to talk about the past history of what kind of. Hey Beth, can you shut that off, please? What kind of. Tell us about the history. When did it start, and what kind of issues did you have?
So historically, I can go back to I've always had migraines. So
Okay.
I was.
And what kind of
headaches.
symptoms?
So basically, it caused me. I needed to go to bed, shut the light off, and take an injection of a migraine
So in
medication.
sensitivity to light.
Yes, very much
Nausea,
so.
vomiting?
All of that.
Okay,
Yes.
like any auras, double vision.
No,
like,
because
okay.
I shut my eyes and went to bed.
Okay.
Close it, shut the door, darkness, go to bed. Had got an injection, and hopefully within a couple hours after getting from the injection, I would feel that at least the headache would be, the throbbiness and all that would be gone. But then now you're feeling not so good from the injection.
Right. So then, what kind of injection was it again?
It was probably like Imitrex.
Okay.
Okay. So again, I worked for a neurologist for 10 years, and this is what I was given.
Okay.
So at one point, I was hospitalized for it, and I was given a medication for that. Once that happened, I did the severity and the intensity had really gone away, but then I was always having headaches on a regular basis.
Okay. So that was how long ago was when you first had your first?
That
migraine?
would have been
like your first migraine or headache?
about 20 years ago.
Okay.
Yeah.
And then you got that injections. You went to
So
the
the injections
neurologist,
never
medical doctors.
worked. Obviously, the injections never worked, and so because the migraines kept coming and coming, and the Imitrex was not working, then the physician I worked for hospitalized me for 3 days for this injection, which again was, same thing. I had to, quiet the whole bit, and then after that 3-day stint, it was better, and then it seemed to have. I didn't have that is the most severe migraine that I've ever had, and then I've always had headaches. So I can tell you, I've always had headaches.
Yeah.
And
So
no one could ever. I've had MRIs. There's nothing there. I've never. And then after that, probably 14 years ago, 15 years ago, then I went to my first chiropractor because I need to try something different.
Yeah.
But they still struggled with trying to figure out what was there. So since coming here, I have had headaches less and less, and I used to have to come twice a week and really need those because I was having a headache. Now I'm coming once a week, and I'm not really having as headaches that I have had in the past as often as I've had them.
Yeah, seeing like what 6-5 chiropractors.
Yeah, I can probably count on my hand. I've seen about 5 or 6 chiropractors. Yeah. You're probably my 6th or 7th chiropractor that I've seen because I'm a cash patient. I am not into the medical. Just because I work in the medical field, I have a hard time with physicians because it's all about the drug, and I try not to take anything. So the chiropractors were my first line to have some other sort of relief.
Right. So after what, 6 chiropractors, 7 chiropractors, definitively you said this is the best treatment you've seen.
So far, I've had really good.
All the doctors, drugs, chiropractors.
So far it's been really good. Like I said, I have.
This is one thing that's really worked for you.
Right. This is the only thing that's been pretty much has really worked for me. That I can't say that. Like I said, I can count. 2 weeks ago, I know I had a headache. Prior to that, I wish I could tell you the last time. That's because I'm not keeping, because that's the last thing I really want to think about is a headache. Right. So obviously now when I do, it's on the forefront because I haven't had them in so long. Right. So they come far and few between, which is basically what I really want.
Yeah, and you're gonna have them a couple times a week, 2-3 times.
I used to have them. I can tell you for sure. You can. My husband will tell you it was at least once a week. I would always say I have a headache, and it would last for 2 or 3 days. Yeah. And then I would go get adjusted, and it would feel better, and it would relieve the immediate pressure. But then sometimes 24 hours or 3-4 days later, I have another headache, even after I've had an adjustment. So the adjustments weren't even holding for me at that time.
Great. And now you can go a couple weeks, even maybe like a month without them, like 2 weeks.
So far I've gone, I have stuck with the once a week. I mean, I was on vacation last week, so I went almost 2 weeks without an adjustment, which I did fairly well. And but I have not really had anything, worth noting that has been terrible.
So something for the medical community. On a scale to 1 to 10, the severity, complexity, the frequency of the headaches were, on a scale to 1 to 10 before you came in was
it was like a 6 or 7.
Okay. Now you'd say they're roughly
they're down to 0 to 1.
Yeah.
And when I do get them, obviously because they're still full. It's a full blown headache. I mean, it's still like a 6 or 7. Where sometimes I still need to be adjusted to relieve that pressure.
Yeah.
And sometimes ibuprofen doesn't even work at all.
Yeah, yeah. So awesome. There you go. Thanks for the testimony again. Okay, Mark.